fellow Toastmasters and welcome guests. Today I am going to be talking about heart attacks.
That sounds very exciting.
Do you know what myocardial infarction means?
No.
Well, if you don't know, today you're about to find out.
All right.
Myocardial infarction is a medical terminology for a heart attack. A heart attack occurs when a part of the heart muscle doesn't get enough blood. It can occur when there's a sudden, complete blockage of a coronary artery that supplies blood to an area of the heart. As a result, some of the heart muscles begins to die. Without early medical treatment, this damage can be permanent. What causes a heart attack? The heart is a muscular pump that needs a continuous supply of oxygen. It gets oxygen from the blood, which flows to the heart muscle through arteries on the heart's surface. These arteries are called the coronary arteries. The most common cause of heart attack is coronary artery disease, CAD, which is a slow buildup of fatty deposits on the inner wall of arteries that supplies the heart muscle with blood. The fatty deposits, called plaque, gradually clog the inside channel of the arteries, causing them to narrow. It is a process that begins early in life and continues throughout the lifetime. A heart attack usually begins when an area of plaque breaks open inside your artery. Blood cells and other components of blood stick over the damaged area and form a clot that suddenly and completely blocks the blood flow to the heart muscle. If the artery remains blocked, the lack of blood flow through that artery can permanently damage the area of heart muscle that it supplies blood to. This here is a picture of the heart and the coronary artery. This here shows the coronary artery, which supplies blood and oxygen to the heart muscle. Here is a healthy heart muscle, and over here is where the blood clot blocks that artery. And this becomes a blocked blood flow. And that is because of the plaque buildup in that artery. And this causes a dead heart muscle. What are the signs and symptoms of a heart attack? Heart attack symptoms vary. Now, all heart attacks begin with a sudden crushing pain that is often seen on TV or in movies. Many heart attacks start slowly as mild pain or discomfort, while some people don't have symptoms at all. This is called a silent heart attack. The symptoms usually last for at least 10 minutes. Chest pain or discomfort is one of the most common symptoms of a heart attack. The pain sometimes starts slowly, or may come on suddenly, or develop over a few minutes. Most heart attacks involve discomfort in the center of the chest that lasts for more than a few minutes, or goes away and comes back. It may feel like tightness, pressure, heaviness, fullness, or squeezing. The feeling has been described like an elephant sitting on the chest. The chest discomfort or pain may spread to the neck, throat, jaw, shoulders, back, either or both, arms, and even into the wrists and hands. Some individuals do not get any chest pain, only discomfort in parts of the upper body. There may be a choking feeling in the throat, or the arms may feel heavy. But often there may also be difficulty breathing, nausea or vomiting, cold sweat, or a sudden feeling of being dizzy or lightheaded. Angina, chest pain, is a similar symptom of a heart attack. But angina pain usually lasts for only a few minutes and goes away with rest. Angina that doesn't go away or occurs more frequently at rest can be a sign of the beginning of a heart attack and should be checked by a doctor right away. Not all men and women have the same symptoms. Women's most common heart attack symptom is chest pain or discomfort. Here are some more symptoms: nausea or vomiting, jaw, neck, or upper back pain, chest pain, pain or pressure in the lower chest or upper abdomen, shortness of breath, fainting, indigestion, and extreme fatigue. Can children get heart attacks? Yes, children can have heart attacks as well, but they are very rare. Children born with heart conditions are most at risk for heart attacks. According to the American Heart Association, the average age of a first heart attack is 65 years for men, is 72 years for women. However, heart attacks can occur in people of all ages, including in their 40s and even younger. In fact, 1 in 5 people who experience a heart attack are less than 40 years old. Do you know what to do when someone is having a heart attack? Call 911 or your local emergency number. Don't ignore the symptoms of a heart attack. If the person can't get an ambulance or emergency vehicle to come to them, have yourself drive them to the nearest hospital. Take aspirin. Aspirin helps prevent blood clotting. Taking aspirin during a heart attack may reduce heart damage. Don't delay calling 911 to take an aspirin. Call for emergency help first. Take nitroglycerin if prescribed. If the person has a prescription for this medicine, let them take it as directed while waiting for emergency medical help. Start cardiopulmonary resuscitation, CPR, if the person doesn't have a pulse or isn't breathing. If you're untrained in CPR, do hands-only CPR. That means push hard and fast on the person's chest. Do this about 100 to 120 times a minute. If you're trained in CPR and confident in your ability, start with 30 chest compressions before giving 2 rescue breaths. Use an automated external defibrillator, AED. If one is immediately available and the person is unconscious, the device delivers shocks to reset the heart rhythm. AEDs come with step-by-step voice instructions for their use. They're programmed to allow a shock only when appropriate. Who are the heart specialists? Cardiologists, cardiac imaging specialists, electrophysiologists, adult congenital heart specialists, cardiac rehabilitation specialists, heart failure specialists, and heart surgeons. Medications used by doctors to treat a heart attack includes aspirin, which reduces blood clot formation. Nitroglycerin is given to improve blood flow and treat chest pain. Morphine is the most common pain medication used during heart attack care. Beta blockers slows down your heart rate to help it recover. Antihypertensives lowers your blood pressure to help your heart recover. Statins stabilizes plaque in your heart's blood vessels, reduces cholesterol, and decreases the likelihood of another heart attack. ACE inhibitors are medications that improve how your heart pumps and lowers your blood pressure. Antiplatelets prevents blood clots. Other treatments include coronary artery bypass graft surgery, which is a procedure in which blood flow is redirected around a narrowed area, allowing blood to flow more frequently to the heart muscle. Implantable cardiac defibrillators, ICD, is a small device that is implanted in the chest and connected to the heart in order to treat abnormally life-threatening heart rhythms, which some people may develop or be at high risk after recovering from a heart attack. Heart attack recovery includes Medical treatments along with healthy lifestyle choices that can assist in recovering from a heart attack and reduce the risk of further heart problems and relieve or control symptoms such as angina. The most important things you can do to reduce your risk and aid heart attack recovery are take medications as prescribed by a doctor, no smoking, enjoy healthy eating, be physically active, control your blood pressure, achieve and maintain a very healthy body weight. Now, do your part, care for your heart, and live a healthy lifestyle. Thank you.